I would say that actually the supplements for men and women would be the same. It's just the manner in which they take them. So women, I like to pulse, I like to cycle their supplements through their menstrual cycle, and men, it would just be more of a consistent application. And so if I could choose, I would say omega-3s, absolutely number one. I know that we hear a lot about, it's important to get our omega-3 to 6 ratios correct, but omega-3s have so much more than meets the eye. So they're anti-inflammatory. They help with depression. They've been shown to help with mood alteration. So for those of us that have a tendency, even if it's cyclically, to have mood or be more irritable or more moody, omega-3s can help with that. They've been shown to actually help regulate hunger, to help reduce or bring down some of our hunger signals. And of course, if you're vain, if you don't care about any of that, then of course it's going to really help you with, beautiful skin, hair, and nails. So if that's not enough of a, if you don't really care about the, the depression and the, all the other positives that it has, it helps you look good. I would say minimum between at a minimum of 2 grams or like 2,000 milligrams of omega-3s a day. And of that, making sure that your EPA is at least 1,000 milligrams. So most, when you sort of look at the 2 different types of omega-3s, the 2 main ones that you'll see in supplement form are DHA and EPA. I would say for any of you that have ever had any brain issues, like if you've had a concussion or you have a TBI or anything like that, you really want to skew more to the DHA because that's really, really been shown to help reduce some of the inflammatory mechanisms that can happen in a traumatic brain injury. But for the rest of us, you want to make sure at least 1,000 milligrams of EPA, and then a total consumption of around 2 to 3 grams. The next one would be vitamin D. Most of us, especially in the past, 18 months, spending a lot of time indoors, a lot of time afraid of whatever. And we want to be really thinking about having adequate levels of vitamin D. So I know we call it a vitamin. It's not really a vitamin. It's actually a hormone. It is part of the birth of our sex hormones. We've been talking a little bit about testosterone and estrogen today. You need vitamin D for that. Also a really potent activator of your immune system. So it helps amplify natural killer cells and your T cells and your lymphocytes. So I would say at a very minimum, like base minimum is like 2,000 international units of vitamin D a day. And then depending on where, you should probably have your vitamin D levels tested. I always recommend that. Ideal range is somewhere, 60 to 80, 85 nanograms per deciliter. But if you are not in that range, you can work with a doctor to help bring you into that optimal range. And for a lot of us that live north, in sort of northern climates, you get all 4 seasons. You get winter. Through the winter, I often will up the supplementation for myself and for my clients that no one's going to go out in freezing weather. So we supplement with vitamin D there. So we got omegas, we got vitamin D, and then the last one will be magnesium. Magnesium is, I think, involved in 320-ish reactions in the body. Some notable ones obviously are helping with muscle contraction, helping an enzyme called COMT or COMT. This is really important in not only our alertness, but it's also important in our estrogen metabolism and detoxification. So you need magnesium in order for that puppy to run. Generally, I'd say women, because we bleed every month and there's a lot of, your body will throw a lot of magnesium into that endometrial lining. If you're not replenishing that, you need to be supplementing with magnesium as well. So those would be and then I guess dosage there would be a minimum of 400 milligrams of magnesium. And then for women, and especially if they're having any PMS type of symptoms, I would be cycling the magnesium so that it's a bit higher in their luteal phase in the second half of their cycle.